This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about how to get rid of carpal tunnel syndrome. So what is carpal tunnel syndrome? So the bones in your wrist form kind of a half pipe. They call it like a tunnel, and you have a nerve called the median nerve, which kind of goes right through that tunnel. Now there's also a bunch of tendons and other things in there as well. And then there's a ligament on top called the transverse carpal ligament, and that's kind of the top of the tunnel. So when people get carpal tunnel, this nerve that's going through that tunnel, called the median nerve, is getting really squished. And the symptoms that people will have will usually be numbness and tingling of their thumb, their index finger, the middle finger, and half of their ring finger. The other half of the ring finger and the pinky are from a different nerve called the ulnar nerve, which can be compressed as well. But for carpal tunnel, it's just those fingers that I mentioned. So if you think you have this, what can you do to get rid of it? The first thing that we do, which works pretty well, is to wear a splint at night. So what does that do and what does that even mean? So at night, a lot of people when they sleep, they do this. And when you do this movement, you end up crushing that nerve. And we don't realize we're doing this because we're sleeping. So what the splint does when you wear at night, not during the day during activities, is straighten that wrist out so that nerve doesn't get irritated. And so night splinting is pretty much always the first line of treatment with carpal tunnel. And usually it works pretty well. So that's definitely where I would start. You just want to make sure you get the right wrist splint, one that has a hard part in the front that prevents your wrist from going. If the whole splint is soft and you can move it, then it's not the right splint. You can go on Amazon or to Walgreens. They have a lot of splints just called carpal tunnel splints or braces. Another thing that you can do if you have carpal tunnel syndrome is something called nerve gliding exercises. You can look these up. It's basically a lot of finger movements here, and it's basically running those tendons back and forth through that tunnel. That sometimes helps release the adhesions on the nerve and helps with carpal tunnel as well. Sometimes if those two things don't really work, we'll do a steroid injection into the carpal tunnel in combination with night splinting and exercises, and that can tend to help as well. Most people don't end up needing that though. And then lastly, if it's just numb, tingling, and nothing works, then surgery is your best option. Outpatient surgery, it's one of the most common surgeries done in the United States. Of course, people want to avoid surgery, but I will say that if your hand is numb and tingly all the time, or you've started to lose the muscle mass in your thumb, I would just get the surgery and skip all those other steps because you could be doing permanent damage. But if it's just occasional tingly, just comes and goes, then I would try those other things first. So I hope I was able to answer your questions about how to get rid of carpal tunnel syndrome. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond, but noting that I can't respond to you about your specific medical condition. If you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.